got into nursing as a default because I started out in pre-med, and I really do like medicine. I decided that I would try nursing and went into a diploma program to get my RN diploma. And I loved it a lot. Most of my career has been caring for patients that were underserved in the community. Well, I've always been an educator. I wanted to be an educator. I can really relate to the students at Hondros because after my initial diploma in nursing, I was working full-time supporting myself and getting my degrees. And so I was doing it in the evenings and having to drive 50 miles one way for work and then 50 miles back to get to my clinical sites. So I really can sympathize with the student population that we have at Hondros, and I can understand where they're coming from. I can understand some of the frustrations that they have with their schooling and trying to juggle family, personal life, and a pretty rigorous academic course. My vast experience has helped me be well-rounded. I teach by storytelling, and I think that they can relate to that when they hear a story about a situation rather than just the book learning. That makes it a little bit more personal and relatable. They may not have had any medical background in nursing, but they have had life experiences. And even something that I've encountered in my career in nursing, we could find instances to relate it into their backgrounds. I really get satisfaction when I see them being successful on an exam. To me, that means they got the message that I was trying to tell them. With the way that we test here with concept nursing, it's not anything that you can just spit back out. It's not anything that they memorize. They have to apply it. If they're successful on their exam, then I know that they got the message of what the concept was. So I've seen tremendous change in the nursing education since I got my original education. I like the concept nursing better. I think that it's more relatable and less stressful than having to try and memorize a bunch of information long enough to spit it back. If you get them in their first term, then you can emphasize and then continue emphasizing what they learned in their first quarter is just as pertinent in their fourth or fifth quarter. That's when it gets all pulled together. It's not easy to be in nursing. They say that nursing, a BSN anyway in nursing, is the equivalent of several college degrees with the amount of information that we have to learn, and I believe it. It's not easy, but it's doable.